Hi everybody. I'm sorry that I can't be in class today. I had an accident happen on my way home from work this evening. So here is my portion of the presentation. So I did the information concerning immigration and immigrants in the U.S., their population, their education, their access to healthcare and things of that sort. So, according to the 2010-2011 Census Bureau data, there was approximately 50 million, immigrants, legal and illegal, in the U.S. This includes their U.S.-born children under 18. Technically, they're not considered immigrants in our country, but because they're associated with the families, that counts in this case. The number of immigrants, legal and illegal, in the country hit a new record of 40 million in 2010. That's a 28% increase over the total of 2000. California, New York, Texas, Florida, New Jersey, Illinois, Georgia, Massachusetts, Virginia, Washington, Arizona, and Maryland are the most populated areas with immigrants, and California currently has the largest population, and the majority comes from Mexico. Mexico is the top sending country for immigration in the United States. The average immigrant household is 31% larger than U.S. households. There's usually 3.12 persons versus 2.4, according to this information I obtained from the Census Bureau. So their education. Based on the 2011 CPS, 28% of immigrants ages 25 to 65 have not completed high school. Due to this lack of educational achievement, it can be deciphered that these immigrants have very little income. Their socioeconomic status is poor, poverty level. They are more likely to utilize social services because this lack of education inhibits them from achieving jobs. And since the U.S. is so big on education and achieving jobs through education, it is very hard to get jobs that are outside of the labor force, which is something that I'm going to discuss further on. So as far as income goes, the majority of immigrants work in the labor force industry, as I said. They do jobs such as farming, fishing, forestry, cleaning buildings and maintenance of buildings, construction, production, and food services and preparation. So they work in restaurants or, wherever they can get jobs. A lot of them do work off the books, so it's difficult to obtain what their actual income actually looks like. So based on the March 2011 CPS, which reflects 2011 and 2010, there's nothing up to date for 2012-2013. 19.9% of immigrants compared to 13.5% of natives lived in poverty in 2010. These are based on annual income in the calendar year prior to the survey, and it also reflects how large the family is. The higher incidence of poverty among immigrants as a group has increased the overall size of the population living in poverty. And in 2010, 16.5% of those in poverty in the country were immigrants. So access to health care. 34.1% of foreign-born immigrants lack health insurance compared to 13.8% of natives. This is greatly going to impact the United States when the Affordable Care Act does go into effect in Obamacare. They account for 26.1% of all uninsured persons in the U.S. The low rate of insurance coverage associated with immigrants is due to their much lower levels of education, as I discussed earlier. Because of the limited value of their labor in an economy that increasingly demands educated workers, those with college educations and completed high school. They hold jobs that don't offer the health insurance, and their low incomes make it difficult for them to obtain good health insurance on their own. It's so expensive, as we all know, so they just can't afford it while they're trying to pay for their families and to live. Now, a lot of this data doesn't include illegal immigrants, but, there's also discussion of more leeway for immigration. if the Patient Protection and Affordable Care Act is found constitutional and is implemented, a very large share of those currently uninsured will receive coverage either through subsidies or Medicaid. And those will be reflected to illegal immigrants and their young children. The 2011 CPS also shows that 21.7% of immigrants and their U.S.-born children under 18 are on Medicaid, compared to 14.7% of natives, aka Americans, and their children. Below is just a table constructing the influx of immigrants by region and their year of arrival. So I'm not sure who is going to be covering this next, but they will follow through with the rest of the presentation. Sorry, guys, that I couldn't be there. I wish that this hadn't happened. It's really unfortunate and stressful. Hope you all have a good time. Thanks. Bye.